Just because someone goes into a long-term care facility doesn't mean that they no longer have rights.
New questions being raised as there are new developments tonight in the investigation at Pine Ridge Health and Rehabilitation Center in Thomasville. Thomasville police spent 2 hours at the site this evening after serving a search warrant, possibly regarding the patient abuse allegations made against the facility.
And it comes after Thomasville police found only 3 staff members caring for nearly 100 patients this past Sunday night. They also found 2 patients dead, along with 2 others who ended up being taken to the hospital with critical health issues. Fox 8's Tyler Harden spoke to the daughter of one of the patients who went to the hospital. He joins us now live from the newsroom. So Tyler, first of all, how is this patient doing?
Natasha Nelson says her 71-year-old father is doing okay. He was released from the hospital today and is not going back to Pine Ridge. This story has shined a light on the possibility of negligence. The National Center on Elder Abuse says only 1 in 24 cases is reported to authorities, and the pandemic has only made it worse.
I'm still furious. My dad is furious. Everybody is furious.
Natasha Nelson's 71-year-old father, John Velverton's last memory of Pine Ridge Health and Rehabilitation Center was being taken away in an ambulance.
He could have been a 3rd person that would have very well died in that facility.
She says on January 14th, the Friday before the winter storm, he called for help in the facility. It wasn't until 3 days later when Thomasville first responders showed up.
He took that as his opportunity to go ahead and let one of the 3 people that was on duty, hey, I need medical attention.
He was rushed to the hospital in critical condition. Her father is now in another facility. Natasha tells me Pine Ridge staff told her dad didn't get immediate care because of a staffing shortage. Well, I took a look at North Carolina's nurse staffing requirements. Facilities do not have to have a specific number of staffing per number of residents, but must have sufficient nursing staff to meet each resident's needs.
Residents still have rights.
Elder Justice Specialist Heather McGill says if you do not feel your loved one is getting the care and support they deserve, to speak up.
Are they, becoming depressed? Do they flinch when you get close to them? Does their hygiene start to look a lot different? Are you starting to notice bed sores?
Natasha says it reminded her of what she saw visiting her father.
Just patients needing attention. They would be hanging literally outside of their room in their wheelchairs. You could hear people moaning from the room. The stench in there was awful.
Heather says a phone call or visit could help prevent this from happening to your loved one. If you can't get in touch or visit, contact the facility. And if you're still concerned, meet with your local area agency on aging.
It is so important to hear their voice, to ask, are you okay? Has someone hurt you? It's just really important to touch base and have that human connection.
We are all that they have, so please check on them.
Now, Fox 8 has reached out to management at the facility and its owners, Principal LTC, and the legal department representing them several times throughout this week, but have not heard back yet. The state is overseeing the control of the facility at this time. Live in the newsroom tonight, Tyler Harden, Fox 8 News.